Statistically, I think 50% of your life, female spends in menopause. Like,
That's happy wife, happy life.
Exactly.
Let's say it's Friday afternoon, horrible weather, and have a girl named Natalie.
Yeah.
She's driving back from work, and she would be your typical patient, 40-ish something, perimenopause, and suddenly lighting hits her car, and when the smoke fades away, there is another girl sitting in the passenger seat, and they're exact copies of each other.
Okay.
One to one, let's call her Emily.
Okay.
And the only difference between Natalie and Emily is going to watch this video, learn everything she can about HRT, and apply it to her life. And then the question is, how their paths would diverge? How would they diverge in aging and everything?
Sure. So just to set the path clear, so there's no right or wrong answers to it. Mm-hmm. Either path can be followed and can be helped along their path, except for maybe if we talking about hormone replacement therapy and cardiovascular protection, bone health, mm-hmm. brain health, you get more out of replacing actual hormones versus doing a natural supplementation.
You're still doing something, but what if you do nothing? You just keep going. You say, I don't want to touch my hormonal nothing. I do like my grandma did.
Well, honestly, what happened? Many women who are now in their 60s, they went through their perimenopause, menopause without mm-hmm. any hormone replacement mm-hmm. therapy. And the reason being is because in 2000, there was a big study done, a women's initiative study, that came with results of the study came out stating that hormones can cause cancer. Mm-hmm. And that caused a chaos among doctors, women, everyone. And so there was taboo on hormone replacement therapy.
It was like for the last 20 years or so.
Exactly. So if you're saying doing nothing, so this woman mm-hmm. did nothing. And I mean, some went through menopause, perimenopause, menopause with a few symptoms mm-hmm. and they were fine. But a lot of females suffered, but they had no choice. Okay. And they went through that process.
What's the downside of not knowing what to do?
So you going through perimenopause, it starts when female starts exhibiting symptoms, maybe hot flushes, maybe mm-hmm. not sleeping well, maybe her mood is changing. And a lot of females that I see come to me stating, I don't feel myself. Mm-hmm. And it's just this general statement of, I don't feel myself. They can't pinpoint exactly
mm-hmm.
what's going on, but they know that they don't feel themselves. And, that's when we start discussion about hormone replacement therapy, and by starting it soon enough, you can help those symptoms, the exact mm-hmm. symptoms that they came to me complaining: insomnia, irritability, hot flushes, and so on.
Definitely not fun.
Right.
Mm-hmm.
So all the symptoms, females who don't have access to hormones, afraid to do hormone replacement therapy, or just want to go through the process. By suffer, I mean they just have to live through those symptoms.
Mm-hmm. It seems to be, at least nowadays, with what we know about it's kind of pendulum between let's do hormonal for everyone, oops, causing cancer. Now, hold on a second. It was just one wrong medication which was doing it, so it kind of swings a little bit back and forth.
It is a pendulum. But I think, like I said, hormones got a bad rap, and it happened because of the study. But what we know now, and there's a lot of studies that's backing up all this, information, is that hormone replacement therapy is good for, like I said, cardiovascular,
bone health,
brain health. I mean, there are a lot of studies that supports the statements.
Yeah, and in a way, if you're in a good mood, you're much more likely to exercise and do better by yourself in all other ways.
Exactly. Yeah.
So you mentioned you have a practice here?
I do. I have a functional medicine practice. Mm-hmm. And like you said, because it's a pendulum and now a lot of people pay attention to hormone replacement therapy, I get these patients, mostly females, some males too, because believe it or not, males need
hormone replacement. I do know. I just had a long interview with Chris, who has his own clinic.
Yeah.
And he's specializing on male hormonal.
Yeah.
My note says that you also teach in Northeastern, in UMass Lowell.
I taught at Regis College. I have a doctorate degree in nursing. nursing and I taught nursing students, nurse practitioner students. I stopped teaching about a year ago because it just became too overwhelming.
Running your own practice and
running my own
teaching?
practice, teaching. I still have a teenager at home, so it's and being a mom, a wife, and all this. It's just became a little
Right. So
overwhelming.
Okay, but so your practice, is it functional? You said, right?
It's functional medicine. I'm a member of Institute of Functional Medicine. So I'm went through their certification. So yes, my approach is more functional.
More functional, yeah. Look at the whole body.
Whole body root cause, looking into, what caused the disease.
Probably a little controversy. Is perimenopause and menopause considered to be a disease? Not. If it's too political, I don't have to answer.
No. And honestly, I don't think it's considered to be a disease. I think it's a stage of life.
Yeah.
And it's just at this particular stage of life, things are changing, and especially hormones are changing, and
Because sometimes it matters from, I guess, insurance point of view and research point of view. Like sometimes I like to say that aging is disease, just because when it's a disease, you can get certain grants to research and treat. When it's natural state of humans, then no, deal with it on your own.
Unfortunately, that's the state we're in right now. Yes, you have to call it a disease, and this is also, we can prevent things before it becomes disease.
Yeah, exactly. Well, I think we'll touch on that a little later about payment and everything else.
Yeah.
So what happens with perimenopause? Just for male audience.
Right. So what happens is, first of all, it can start happening at about maybe 35, 40 years old, when we don't even think that this is the the beginning of perimenopause, but it can happen. So it can start with irregular periods. Females start experiencing longer days between periods. It can be shorter, it can be longer. It can be it's just irregular, let's put it this way. And then followed by different symptoms, such as, like I said, it could be hot flashes, it could be, sudden change in mood.
Is it estrogen issue, or is it some brain issue? Like what drives it?
So it's actually all three hormones. It's estrogen, progesterone, and testosterone. And what happens is progesterone and testosterone starts to decline earlier, and then we see decline in estrogen closer to menopause. So when we lose that balance between estrogen and progesterone, that's when we start seeing or experiencing those many different symptoms.
So is it the same as with males? You have like LH and FSH hormones signaling down?
Right, but producing follicle, and yes, and that's what then stimulates ovulation, and that's the cycle of
because as far as I remember, in males, it's mostly testosterone which kind of goes down. Is it
production?
Same?
It's
kind of similar mechanism, but estrogen goes down. Like what's?
It's similar mechanism. Yes, yes. FSH stimulates follicle, then estrogen goes up, then progesterone goes up, and then if ovulation occurs, and then period, and then the cycle repeats itself every month. But when hormone starts to decline, that's where we start seeing all those symptoms.
And so what, like the first signs? You said not feeling yourself, but are there any other signs?
Insomnia, I would say.
Insomnia?
People, females are not sleeping well, waking up in the middle of the night.
Isn't like that everyone of a certain age?
Not necessarily. I mean, you have an Oura ring. You probably can track your sleep and see how well you sleep. I mean, personally, I don't have any problem sleeping and never had. So no, it's it's very personalized. Some get affected by sleep. Some get affected by just unexplained anxiety. I would say another big complaint that I hear. It's just something that feels not right, and that's how they explain it.
And then you just go and measure hormone panels.
And then you can right. So it's measuring hormones. It's also listening to the symptoms and putting two and two together. hormones are going
because also
through the cycle.
Cycles, so you need to know when, otherwise it's going to be all...
We usually like to check hormones during luteal phase, which is the second phase of the cycle. That's where your progesterone level is the highest during luteal phase. So, and when we see drop in progesterone, we can then see that there is some disbalance between estrogen and progesterone.
So we're not actually measuring estrogen.
We're measuring all three hormones, but we're looking at luteal phase. We ask female to draw blood at a specific time to catch that luteal phase.
And does it matter if you measure it in the morning or in the evening, or?
Doing it in the morning is the best. Yes.
Is the best.
Yeah.
Let's say if you went through perimenopause, menopause. Is there a time when you say, okay, now it's too late to do anything?
I don't think there is a time that you say it's too late to do anything. What research has shown that if you start hormone replacement therapy within 10 years of your menopause, that's where you get your most benefits for cardiovascular protection, for bone health. Mostly cardiovascular protection. After 10 years, the idea is that the cardiovascular disease has progressed to the point that even if you start taking hormone replacement therapy, it's not going to be as helpful for your cardiovascular health. But listen, there are other things.
But it's still helpful for your mood and everything else.
It's the mood, it's your brain, it's your libido, it's your sex life. So
is it mostly driven by estrogen or combination of everything?
What is it?
The mood, sex life?
I think it's a combination of everything. The other most important hormone is testosterone. That's, again, we usually, when we talk about hormone replacement, or a lot of us think about estrogen, progesterone for females.
You kind of forget about it.
Exactly. We forget about testosterone. And testosterone is responsible for, feeling, that energy.
Assertiveness.
Assertiveness, and if you go to the gym, it's your muscle mass, building that muscle mass, having that brain alertness. That's testosterone, and libido, of course. So it's very important too.
So what would be like the biggest, let's say, mistake?
It's just starting it when you start, not to ignore your symptoms, and start hormone replacement therapy, if it's indicated, as soon as you can, and don't be afraid. It's actually, can be pretty helpful.
So when you say indicated, what is
so if someone has active, for example, if someone has been diagnosed with breast cancer and has active breast cancer, I wouldn't start hormone replacement therapy right then.
Does it depend on the type of breast cancer?
It doesn't depend on the type, but if it's an active breast cancer, I wouldn't do any hormone interventions until
not to complicate things.
Exactly, until it's cleared. If someone has some unexplained vaginal bleeding or anything, so that needs to be investigated before. If it's a healthy, if it's a female who is in her perimenopause and start experiencing symptoms, I would say don't wait too long.
Basically, if you're irregular, go measure yourself at least. Talk with a doctor who understands.
Talk to your doctor, measure your hormones, and start taking hormones to feel better.
How long does it take to feel better?
So when you initially start, I would say probably 8 weeks. It takes about 8 weeks to start feeling, some effect from hormone replacement therapy. But it's a process. It's working with the female. It's finding balance, because we're all unique individuals. There's no a set protocol for all 40-year-olds or for all 50 years old. It's listening to what your complaints are, and then finding your own protocol.
I'm just curious, why does it take so long? If you're, let's say, putting that estrogen patch, shouldn't immediately go to your brain and signal that, hey?
Levels. You need to certain levels for example, for protection, for bone protection. I think you need to reach level of between 40 and 80. So it's reaching that protective levels.
So it takes that long to build.
So you start low, and usually what I do is I start low with estrogen patches or creams, testosterone, progesterone, and then you build up. Yeah.
Okay, well, you said creams, you said patches. What
So
do you have on the menu?
It's actually personal choice. It's a preference. So if female prefers patch, sure. If female prefers cream, that's another option. I also worked in the clinic where we did pellets.
Like under the skin?
It's under the skin. So
That's for estrogen or everything?
It's for estrogen and testosterone.
Uh-huh.
So it's really its preference. It's who sits next to you. You explain all the options.
So
and then,
explain me the options. Like why would I want patch versus cream versus pellet?
Again, some females are very reserved and they wanna, they think that cream will give them less maybe side effects. I don't know. So they start with cream. Some go right to the patch. Okay, it's also. I don't know if it's just, again, it's the preference. Pellets, because pellets you insert under the skin, they last for females about 3 months, for males 4, so you don't have to do anything. Once you insert it,
yeah, it's probably painful.
It's not very painful, no, because we numb the area and then make a little cut and then put it in. So it's not very painful, but you don't have to remember to apply cream every day. You don't have to remember to take a patch twice a week.
And patch you just put like stick on yourself, like small piece,
right? It's a small patch that you put it, like on your abdomen, and you have to change it twice a week.
Yeah,
twice a week.
Yeah. So it's like 3 days, and then
and then you change it.
Are those patches they put more estrogen in you like on the first day and then gradually taper off?
No, I think
or they consistently
put some some level into the bloodstream.
Because as far as I know, those injections for testosterone, if you do them like weekly or semi-weekly, you get huge spike in the beginning and then it kind of gradually fades out.
True.
So for that reason, let's say cream might be more kind of stable.
Sure. So with testosterone too, that's why we do testosterone twice. I recommend doing it twice weekly.
Yeah,
so you don't get
go
that
up and down. Yeah.
Right. So you're more leveled. Yeah. Yeah.
What about progesterone?
Yeah. So progesterone, very important, especially if female has a uterus. She has to take progesterone. She cannot take estrogen without progesterone. And progesterone is considered to be a relaxing hormone. It's a hormone that we recommend taking in the evening. What it does, it acts with GABA receptors in the brain and it relaxes you. So,
that's the one which is responsible for sleep? And those wake-ups?
That's the one is responsible for sleep, for better sleep, hopefully without interruption, yeah.
And you said if you have uterus, you need to take it, otherwise it just grows? Or
you have to, because then, yes, if you don't balance it with progesterone, estrogen has a proliferative effect, and then it can, cause some growth.
Endometriosis.
Exactly. So always balance it. Even if female doesn't have a uterus, she does not have to take progesterone. But still, it's recommended.
If you sleep better,
exactly.
Why wouldn't you?
I mean, progesterone receptors are all over the body, from head to toe. The same with estrogen. The same with testosterone. So they all need hormones.
Yeah. And are there any differences in? I know there's progesterone, progestin.
Progesterone is bioidentical, and progestin is more chemical. So.
Then differences between them?
So progesterone, because it's a bioidentical, it's very structurally close to what we produce. It's considered to be a safer way of taking, progesterone.
So progestin is just for treating all kind of issues like bleeding, or what was it used for?
Not necessarily. It's just before. That's what medicine used to treat females.
Oh, so it's just development of technology basically from progestin to progesterone.
Progesterone, yeah.
And with progesterone, I know there are different ways to take it.
So for better protection, it's better if you take it in the form of capsules. I mean, also progesterone can come in the form of cream, but I think it's for protection, for uterine protection. It's better to.
Do you need to cycle it as it cycles in nature,
right?
Or do you take it consistently?
So it depends. So if you have a female who is still has regular periods. and we measure that progesterone during the luteal phase, and we see that the levels are low, then we can start replacing progesterone, but only during that luteal phase, which is days 14 through 28. And this would be for a female who is cycling. If you have a female who has very irregular periods, sometimes females can have IUDs, then we can start them on a daily.
But smaller dose?
Yeah, you usually, like I said, I don't start at the highest dose. I start low and then gradually go up based on the symptoms.
And you said testosterone. Are you also applying it separately, or?
So for female, well, actually for males too, but females, testosterone comes in the form of cream, and injection for females too. It's just a smaller dose, versus males dose. Yeah.
How do you measure testosterone in females? Also blood test?
In blood.
Is it sensitive enough to pick up those levels?
Yeah, we do. We measure 2 levels. We measure total testosterone. We measure free testosterone in blood, and there are other biomarkers that will measure sex hormone binding globulin. Is important to measure.
Is it a single test, or I know that in males you need to measure it several times because testosterone also goes up and down, and if you just measure it once, you kind of get a sketchy image.
Well, and it's only because you want insurance to cover your testosterone.
Yes, in a way.
Yeah.
So it's more insurance requirement.
Seriously, because if if you have a male who has testosterone of 200,
you probably need to do something.
It's almost like at the dangerous levels, 300, and I've seen it in males, younger males. That's what's the scary.
Males don't have perimenopause, but everyone has obesity, and that can definitely drive
down.
Yeah.
So, but for females, we don't. I see what you mean now. We don't measure it 2 or 3 times because it's not covered by insurance anyway. So
so you take that snapshot in luteal phase, and based on that,
for testosterone, it's not. Luteal is only for progesterone,
but you already measuring, so
So and you just take that measure. We have certain ranges that are sort of expected for that age, and if it's low, and then and female complaining of symptoms, then we put 2 and 2 together and come up with.
So with females, testosterone also goes down, and then you can put it back to physiological levels?
Physiological levels, not super physiological. We're not looking for...
unless you're competing in bodybuilding. That's a separate story.
Separate story. But also what's important to measure is DHEA, which is an adrenal hormone. That's the precursor to testosterone, that you also want to have at optimal levels. Low DHEA will have low testosterone, because that's...
I think the only thing we cannot measure is how your receptors are working. So you sort of work of symptoms.
So it's symptoms, sure.
For DHEA, isn't it like supplement in the States and regulated substance in Canada? Do you know?
So it's right. It's so interesting. I actually surprised that yes, they have DHEA on the shelves.
In United States, kind of strange. Usually it's other way around.
Exactly. And I think it should be regulated because it's a hormone, and you can really, depending on what levels of DHEA you have, you can do yourself a damage by taking too much. I think it's. I don't know why it's on the shelf unregulated, but I think it has to be regulated.
If somebody doesn't want to take hormones, and only want to stick to supplements, well, DHA is kind of questionable, but what else, like on that menu, if somebody, back to our Natalie, she doesn't want to do any hormones, what she can do?
Right, so there are supplements that you can take to, to go through perimenopause, menopause. They're a natural plant called Maca plant, and they're different...
Is it a root?
Maca root, and there's different Maca roots that combination of the Maca root can actually work for perimenopausal women, menopausal women. There's a supplement company called Symphony. I don't know if you know.
It kind of rings a bell.
Yeah. So they're big. This is what they do. They actually look at perimenopause, menopause through natural supplementation, not hormone replacement, but like a Maca root and
I just checked Fullscript and Symphony is there. Or if you want to check any other good quality supplements, medical grade supplements, there is a free article on our Patreon about how you can save up to 30% on them. It's a win-win for everyone.
What else you should be paying attention to?
Well, I mean, definitely pay attention to what you eat. Definitely pay attention to sugar, insulin levels. Very important. As we age, we become more insensitive, more insulin resistant, and once we lose that hormonal protection in menopause stage, then we become more insulin resistant. So definitely looking at, how much sugar, carbohydrates you consume, maybe measuring insulin levels in blood, measuring hemoglobin A1C in blood. Very important. Also, working with your provider to improve those levels. Exercising, weight-bearing exercise is very important for females. Again, as we age, if a female doesn't want to take hormone replacement therapy, then we need to think about bone health.
Even more.
Even more.
Because somehow it's, I don't know why, but it's opposite, right? The older somebody gets, the less he thinks he should exercise.
Oh, no.
For some reason, I know I'm saying it's right, but that's right. What people say, like, I'm too old for this. Or I'm a girl, I'm not going to lift heavy. Like, when it's actually almost like an opposite.
Almost like the opposite, I agree, because it's very important. Before I became a functional medicine, I worked a lot with elders, and you see a lot of hip fractures.
Yeah, that's almost a death sentence after a certain age.
Unfortunately, so we need to be strong, exercise.
I know for testosterone there are a lot of booster testosterone supplements, but they can help you maybe 5% out of 90.
Well, so like if you want to do, I would say, there's also another route called Vitex. That's another supplement that you can take, and it's a progesterone-based plant that you can take that mimics progesterone. And like I said, some females who are very hesitant to start taking hormones, they can, but I can't promise that it's going to work or that it's going to relieve their symptoms.
Yeah, it's kind of interesting how a lot of psychology involved in, I guess, at least to the later studies, much safer treatment than it used to be.
Hormone replacement?
Yes, which makes you feel almost new again.
Right, definitely, and it alleviates so many symptoms, that's unnecessary symptoms.
What about side effects?
Side effects of hormone replacement therapy, only good side effects.
Yeah, mostly good, right? Too energetic too.
I mean, sometimes, it can happen that a woman can experience bleeding, if she has a fibroid that she doesn't know about. It can happen. In that case, definitely, she needs maybe some kind of ultrasound to look inside to check for bleeding, and 90% it's always benign, and she can continue with hormone replacement therapy. I think that's the only.
Any weight gains? That's probably the number one. If you go on Google and search side effects of, it will be like the number one. At least discussed.
But I disagree. I disagree because also, we got to take a look at what thyroid is doing, okay? Because sometimes we forget. I mean, and when I'm seeing patients, yes, they come to me for hormone replacement therapy, but I'm not concentrating only on
check all hormones.
I want to check all hormones because if thyroid is not functioning properly, that's where your weight gain will come from, okay? And I think if we do everything right, I don't think hormone replacement therapy causes weight gain.
Yeah.
Okay, it could be that insulin resistance that also plays a role.
Yes, of course. Yeah. But it's. I was thinking about like psychological stuff of things, and what I've heard from people around, that the main worry is, I'm going to gain some weight. I'm going to gain some weight.
I think if anything, a female will lose weight because
because you're more active.
You're more active. Yeah,
Right. What about clots, strokes, heart disease, endometriosis.
Right. So I think there's a small percent if estrogen is taken by mouse by pill, there is a small percentage of blood clots. It can happen. Yeah. So right. So speaking of someone who has blood clotting disorder, maybe should be careful with not taking estrogen as a pill, maybe doing more a patch form or cream form. I would say that's it. I don't think I've read a lot of studies that show that it causes stroke or cardiovascular disease. Issues. Clots, it's a very small percent. Yeah.
Cancers.
No, it does not cause cancer. So that's
because
it's again, if it's done right, if it's done under supervision of healthcare professional, if you measure your levels, you should be pretty safe.
I would think it should reduce them because you're more active, you have better health in general, your immune system working better, you sleep better. So if you should actually see, I guess, less.
But even think when we're young, right, in 20s, 30s, we have a lot of hormones going, like estrogen, progesterone. We don't get cancer that age.
Much,
the cancer happens after we reach that menopause stage. So
What's your interesting edge cases, if you've seen any in your practice?
Interesting case, just recently, not me, but one of my colleagues had a female who's 80 years old came to and asked for hormone replacement. 80. Okay, so life doesn't stop when you're 80. We want to feel good at any age. So
Yeah, absolutely. At least we live longer and better, and hopefully
quality. I think the length of life matters, but if you don't have quality,
that's the point.
I don't know.
That's the point. But I think the quality drives how long you live as well. Because if you don't want to die, you generally live longer.
True.
Who should not be on HRT?
So again, someone who has active cancer, they should not be on HRT. Someone who has clotting disorder, who just think about modalities and not use something by pill, but do patch or cream. But otherwise, I don't know. I think there's it's good. People,
Any other precautions? Birth control? Does it play into fertility in any way? What can happen?
For females using hormone replacement therapy, it will not cause infertility. No, if you use progesterone and testosterone, you just have to be careful if you're still female who is cycling. Just use protection.
Still need to use protection
because you can get pregnant. It's different because for males, I see is that when
exactly. You apply testosterone, you almost chemically castrate yourself. You can restore it later.
You can restore it, but yes. So that's why it's important, just to, when you do males or take care of male patients, just to make sure that, they don't want to have kids anymore. But for females,
Still you need to use protection.
They need, just to make sure they use protection.
I think we'll discuss that exercise should go along the way regardless.
Lifestyle regardless. No matter what we do, supplements, hormone replacement therapy, I think fundamental of everything is what we eat. It's our environment. We live in very toxic environment nowadays, and like a lot of plastics around us that really mimics estrogen when it enters our body.
Wouldn't that be a good thing?
No, because
you almost get your estrogen patch.
Right, but then it become overly. You have more estrogen than progesterone, so that's what happens.
Out of balance.
Exactly. Sometimes you see levels of estrogen. In fact, yesterday I saw a female who's I probably number won't tell you anything, but I can tell you it's very high. It was 600. It was very high. And progesterone level was very low. So there are a couple of things can go not wrong, but why it happens. It's either she's not detoxing her estrogen properly.
Is it
You
like
know, it
COMT
could-
mutation? Or?
Exactly. Well, it could be COMT mutation. It could be just congested liver that it's not processing. It could be her gut health that it's not also not at the best stage. So it could be a detox issue for females. Okay, so also very important to keep an eye on and making sure that female is not constipated, going to the bathroom every day, and
Things
it's a
flow.
hygiene. Yes,
Yeah.
yes, definitely. Yeah.
It's not like you're on HRT and you can relax.
No. So the biggest mistake a female can do is, yes, come see a provider once, receive her hormones, and then say, okay, I'm all set. No. This is a process, and it needs to be followed. Initially, it's maybe initially it's 8 weeks, but then it's every 3 months. It can be after you're balanced. It could be every 6, every year, but I always see a provider, never just.
So how do you look for that kind of provider?
Good question. I don't know. Some people just call me out of blues, like if I'm talking about myself, or you. I guess you can Google functional medicine doctor, hormone replacement provider. Word of mouth.
Word of mouth.
If you have a friend who doing it, you share it with your friend.
I don't think your primary care is going to be much of a help. At least,
in most cases, no. In most cases. Nowadays, although I hear some providers are okay checking hormones and maybe starting estrogen patch. Okay, but they're not comfortable with doing progesterone, definitely not testosterone, definitely. So
it's just kind of slippery slope, right? If you go out of balance.
Well, but because if you're not trained to do it, you can't really offer things to people that you don't know how to do it. So I totally understand primary care providers that if they're not trained in hormone replacement therapy, they
So in a way, at least in my head, that would be a red flag if you only offered estrogen and nobody talks with you about other hormones. It would be like,
True. But it happens.
What else would you look for?
You can read reviews, or you can call, like me, I have a discovery call. People can call me and we can go over their symptoms, and I can tell them what I offer, and then we can decide whether the person wants to continue with me. But it's important, and like I said, it's not only hormone. You have to look at
you look at the whole picture, and that's probably like the biggest yes which you should work with. As a doctor, he looks at everything. How you sleep, what's your environment,
exactly,
what your other hormones are doing.
If I only doing estrogen, progesterone, testosterone, I think it's not functional. It's just again you're doing conventional medicine. But if you're looking at everything at the whole picture, everything like your liver health, your gut health, brain health, thyroid, everything. Iron levels are very important. I see a lot of low levels of iron that can cause similar symptoms as
similar, because you have anemia and you feel
hair start falling out. And I mean similar symptoms as you would say maybe it's a perimenopause, but it could be as simple as iron.
Yeah, it could be just something simple as mold.
Exactly. Right.
How is it all paid for?
Cash.
Cash only.
Well, because going back to checking
that's where
testosterone level.
That's where we started, right?
Right. So insurances very tricky. They don't pay for a functional medicine. They might pay for maybe some part of it, but not everything. And so it's
that's because that's conversation I just had online with somebody when not me, but I mentioned that if you treat menopause as a disease or perimenopause as a disease, you could have all these treatments covered by insurance.
Right.
And they're like, it's not a disease.
Right.
But that's going to be much more expensive.
Exactly. And again, I don't think in perimenopause. Yeah, in menopause you can connect it to vasomotor symptoms, and then it has an ICD code, and then you can
at least try to do something.
Use your insurance. But in perimenopause, if someone is all of a sudden anxious and irritable, they send you to psychiatrists and they
that's
prescribe
SSRIs, and
that's
that's
it.
like completely different.
Exactly, and I see so many females on, I don't know, Lexapro for what? I mean, there's place and time for SSRIs.
Sometimes it really helps, but
Exactly.
most of the times it just...
Exactly, but not every female who is in her 40s.
So you pay out of pocket for the doctor visits and for all the creams and...
Right. So there is some room you can use your insurance for progesterone if yes,
estrogen patches.
and estrogen patches. Yes, if you want to go a cream route, then it goes through compounding pharmacy.
Yeah, it's compounding and it's cash.
And then it's
basically.
cash. Yeah, and testosterone for females, it's cash only because insurance won't cover.
It's same thing with males. You want testosterone?
Right. And then, testosterone can come in different kind of oils. The pharmacy can only have one oil, but if you react to that particular oil,
you need to change pharmacy probably.
Or do compounding, and then they can, compound.
So speaking of males, what we as males can do to help on a psychological level, on a home level, like what would be your...
be supportive for your wives, sisters, and realize that she's not crazy. Maybe she has this crazy episode, but not because she's crazy, because she's going through a certain period of time and stage, and she needs help, and maybe support her during that stage. And if you have more knowledge that female partners share your knowledge and
usually in the families only one person has knowledge and has to
kind of
cover for everyone.
So that's I think it's very important.
I think it's a good place to wrap things up.
Okay.
Anything I haven't asked?
No, thank you. This is great. I think the more people it reaches, the better. Because then I think raising awareness is important, and just raising awareness and making sure that it's safe. Don't if it's done with a proper healthcare professional, if it's done properly,
if you do it to physiological levels with proper care, and
it's safe. Women don't have to suffer.
You'll live longer, better, and if you're male in the family, you'll live better, longer too.
Exactly.
That's happy wife, happy life.
Exactly. And then statistically, I think 50% of your life, female spends in menopause. So 50.
Yeah,
so
that's a lot of time. So
why suffer this 50%? No, just go out there, have fun. And I think that's when life begins, when your kids are out.
Your kids are out, you finally have your dream vacation, you want to go there, and then you suddenly don't have energy.
Right. And
because your estrogen is low.
And that's exactly what happens. And you feel like, okay, I don't want to see anyone, I don't want to do anything. But the life just started. No kids, your wife or your husband, and that's it. And
So let's do it.
Let's do it.
All right. If you want to get in touch with Sophia, I'll leave the links in the description. And to have the full story, I just had an excellent conversation with Chris about male hormones and testosterone replacement therapy and everything else around it. Go check that out. Living is smart, aging is bad, and stay tuned.